Hello, my name is Chad Comer. This is my presentation on trauma-informed care. Why us? Well, um, in the spirit of the emergency department, it's going to be short and sweet to the point. The emergency department, because we are the first impression of the majority of patients that come through our healthcare system. We set that stage, that foundation for patients as they come through, just because we are the front door. The trauma department included you on this because you guys are very good on identifying the physical things, the gunshot wounds, the stab wounds. But once all that settles, there's another emotional side to things, the mental health side that we have to be a little bit more aware of. And then really all of us in the emergency department and this hospital, we have a very diverse populace and very high volume of patients come through. So by being a little more aware of what's going on, we can really help our patients out a lot better. So what is trauma-informed care? Well, according to Behring, trauma-informed care is a strength-based framework for human services that assumes that individuals are more likely than not to have a history of trauma and acknowledges the role that trauma may play in the lives of service users, care providers, and the public. So basically understanding that trauma is out there and people have gone through it and it affects them all differently. Then knowing that it can be a part of what might be bothering them or what brought them in the first place. And in the emergency department, we do have a treat 'em, street 'em kind of personality. It's the way that we kind of view things. We are all about speed. However, this is a little bit of a paradigm shift for us. Sometimes taking that second and listening to your patient and asking some real open-ended questions and some real thoughtful questions as opposed to, why are you here? What do you want? I'll go over it later on in later slides so you can see what I mean. Why is this important to us? Well, we want to improve patient outcomes. We're all here to help people. This is all the reason why we became nurses. And we want to just improve their outcomes. And if we can get them to kind of open up or get them to see that it's there and get that help, again, we can just increase that overall outcome for them. It also helps us increase their resilience and our own, just knowing that the resources are there. And when would we want to use this? First chance. Use that with this first impression. Use it with, that first interaction with your patient. Establish that bond of trust. Establish that open door of communication and be clear, be straightforward. But the best things we can do sometimes is being completely honest and direct with our patients. Establish those goals. Impact of trauma. Well, according to Behring, trauma may occur because of a harmful incident or series of events that are emotionally disturbing and life-threatening, such as violence, neglect, abuse, disaster, serious illness, or historical injustice. It basically covers almost everybody that comes through our department. And by knowing that we all have some sort of trauma in our history, can kind of help us really engage the patient better and kind of, help them get through what's going on. The physical ones, we can see the broken leg, we splint it, we plug the holes of the gunshot wounds, but the emotional ones, that's where things start to come into play. That's got to be a very distressing thing, being shot and being hit by a car, something like that. And then the social, say you were hit by a car and that leg is broken. Now you're stuck in a hospital bed. You might have been up, you might have run 10 miles every day, you might have done, but now you're stuck staring at the ceiling of an emergency room for a week. So, it's one thing we do want to keep in mind. And then the behavioral, except with trauma, it can cause a lot of behavioral issues. And by knowing that, we can kind of be a little more prepared to help. Principles of trauma-informed care. There's 6 principles that I'm going to go over with you guys today. First one is that trustworthiness, transparency. You're going to see a lot of recurring themes with this. Again, you want to establish that trust, that bond, and support it. By keeping that bond and keeping that trust with your patient, you can really improve that outcome and help them out. And you can do that by being direct, being clear, use clear language. You ever been in a room with a patient and the doctor comes in and they spout everything that's going on and the patient turns and looks at you and says, what? make sure that they understand what's going on. Safety is the next one we're going to go into. Safety is, you want your patients to feel safe. If they do feel like they're in a safe environment, they will open up a little bit more to you, allowing you to help out. Let them know they have a choice. By giving them that choice, you give them a little bit of control. Patients a lot of times are very anxious when they come through. And by giving them a little bit of control, you give them that feeling of safety. You alleviate that anxiety a little bit. And again, use that clear communication. Like, talk to them, tell them what's going on, tell them what they can expect. Next one is peer support. Regardless of why people come in, we're going to help them. We have to try our best. It is hard sometimes, but we want to stay as non-judgmental as possible. And then also by knowing that what resources we have out there. It doesn't matter if you were, again, hit by a car, or if this is your 17th OD for the month. Know what resources we have. Talk to your case managers. Talk to your social work. Let the patients know that there are resources out there to help them. Next one is collaboration and mutuality. Include that patient in their care. Again, while you're communicating with them, let them know, let them make those choices and accept those choices. The easiest example I can think of is the DNR, DNI. It may not be what family likes. It may not be what you like as a nurse. However, you want to support them in their choices and define that mutual goal. Like I said, what do they expect out of the encounter today? And what is your expectations out, and see if you can find that mutual goal. You want to empower them. You want to give them voice and choice. Encourage involvement and that flexibility. Let them know if they don't want a medication or they're concerned about a procedure. You can talk them through that. Advocate for them. Let them know that their involvement counts. And again, support their choice. That's very important to support their choice. And then lastly, just being aware of cultural, historical, and gender issues. Again, being in such a large city, there's a lot of diversity. There's so many different things going on out there. And just being sensitive and being open and listening to our patients can really help out. Now, how does this work for us? Well, according to Anderson, understanding how to manage this trauma appropriately and not only support individuals through the experience, but also increases opportunity and capacity for provision of trauma-informed care to patients and colleagues going forward. Again, a lot of words for just knowing it's out there and knowing how to approach it will help us take care of patients better. Again, communicate with them, involve them with their planning, keep them in the loop of what's going on. Listen to what they're saying. They have been with them their entire lives. You may have only known them for an hour or two. Reiterate those shared ideas. Let them know that you are listening and that you are hearing what they're saying. And sometimes that's done by just being quiet. Be silent, open, and just kind of engage them. Let them know, you are there to listen. And then kind of guide them. Like, if they are asking questions, guide them through it. Give them the answers that they're looking for. And again, just kind of incorporate, everything that you kind of incorporate that into their answer. Like, talk to them, explain to them what's going on, keep them in the loop. Now, the expectations, we want to reframe our questions. In triage, it's the perfect place because instead of saying, what do you want? Ask them, hey, what works best for you? Why are you here versus how can we help you today? Advocate for your patients. You want to listen, include them in the care. And then just knowing that the resources are out there. It's an amazing resource to have. There's so many things out there that we can help people with beyond just the IV meds and turkey sandwiches. So, conclusion, again, like I said, I've kind of gone over why us. I talked a little bit about what trauma-informed care is and how it works. And again, just that expectations. What can we do to improve patient outcomes? So, I really appreciate you guys listening. These are my reference and my citations, and thank you very much.